My name is Arlette Tormey. I am a registered nurse at Tahoe Forest Cancer Center. I have a master's degree in nursing science and healthcare leadership. I'm an oncology certified nurse, and I'm also a certified nurse in infusion. My typical day and work life looks like me getting up and making lunches for 2 little kids. When I get here to work, I review the patients that I've been assigned for the day. I also review some of my coworkers' patients because we do need to check each other's work. We do huddle as a team, so we go over every patient coming in with the entire center. So the front staff, the doctors, the schedulers, the nurses, the laboratory scientists, everybody knows who's coming, why they're coming, and what we expect to do for them that day. And then from there, I do primarily infusion, so I am administering the treatments to the patients. With my background in environmental education, education has always been a big part of what drives me and gives me joy in my work. As a nurse, we're teaching all the time. We're always teaching our patients, but I actually love teaching staff. If I have an opportunity to go over a new therapy plan, a new process, a new initiative with the staff, then that's where I get the most out of my work. I've started a journal club with the nurses, basically like your book club. So we still get together and we still laugh and we still have a good time, but we are selecting academic articles specifically about cancer or a therapy or an aspect of treatment, and all of the nurses read and review and we discuss. One of our recent journal clubs, we actually just focused on resiliency and wellness, and we laughed and we enjoyed each other and we brought each other gifts, and it was just a really wonderful time to bond. I help over in the main hospital, and I train every new staff member at Tahoe Forest Hospital, not just the cancer center, on central line access, on accessing people's veins, on all of the products that we have. Oncology Nursing Society just came out with some new guidelines on how to safely give anti-neoplastic or anti-cancer medications to patients, and they have added additional steps for us for safety. And so I'm trying to incorporate those steps into our workflow right now. That has really rejuvenated, in a way, my work, because I'm able to apply some of my knowledge. I do have a master's degree in nursing science as well. And so right now I was able to take those guidelines and I was able to create basically like a research project, like a thesis. And I was able to review our process. I was able to find areas where it's weak. So it's bringing back this background of science and academia to what I do every day. When I am done with work, I have a tendency to just kind of turn it off and go home. And so I can really be there for my family and really be mom for them. My husband will say, "How was your day?" And he usually just gets "it was good" or "it was bad." And I can't really tell him the bad things that happened or explain that I took care of your friend today, because that's hard. Because we are a small community. It is hard. It's hard to explain to my family and to my friends everything that I do on a daily basis, because we're in a small town and we're in a small community, and I see my patients at the grocery store, I see my patients walking on the Legacy Trail, and sometimes I can't even acknowledge them because of privacy issues. And so it's so nice when somebody acknowledges me, and then I can respond back. So it's difficult, but it's also really special to work in a small community. So I knew that I wanted to be a nurse, not right after getting out of college or even going into college, but I actually went to school for environmental education and biology. And when I graduated from college, I was working with sea turtles on the coast of South Carolina and North Carolina on a couple of undeveloped islands. While I was going through that, realized that I wanted to go back to school to actually become a nurse midwife, and it was my intention to birth babies for the rest of my life. When I was in nursing school, I was on a rotation in oncology, and I had a patient who I was taking care of who was a yogi and was diagnosed with esophageal cancer. And so I had this kind of profound realization with this individual who had spent his life really focused on his breath, and it was so much a part of his well-being. I think I just in that moment realized that cancer was kind of an equal opportunity disease, if taking out the positive connotation of that. It doesn't choose, you don't choose, it can affect anybody. When you have a patient with a cancer diagnosis, what you have is a team member. They're 100% committed to what you have to help them, and they give you everything in return. And so it's very rewarding in that aspect. Oncology, specifically, the medicine aspect of it is I went to school to be a scientist. I'm a nurse, but I'm also a scientist. And so we're always looking at the new medications. There's always something new in oncology. The new treatments, the cutting edge therapy. It keeps things from getting stagnant. So the relationships that you have with patients, the treatments that you have to offer, the knowledge that they bring to you, the knowledge you give to them, it's always changing and growing, and that's what I think makes it special. It's what I think makes it sustainable for a career. So in thinking about commitment and fearlessness and imagination, it really does take all three. There is a huge level of commitment to walk into this building and to be present for our patients. And I give it my very best 100% every day. Everything I have, I will give. And when it comes to fearlessness, I do think that sitting down with somebody and having a difficult conversation, when I ask you how you're doing, it's not oh good, I'm good, fine. I mean, we really, really want to know, how are you doing? And tell me everything. When it comes to imagination and imaginative, the work of a nurse does take a lot of creativity. We will make things work. We will find different solutions to a problem, dress a wound a different way to make something better for the patient. We won't MacGyver things the way that they're not supposed to be put together. A patient is having difficulty getting food on the table. I have somebody who maybe has a 1-year-old and needs to come in for treatment, and who's going to watch their child? And so we need to be creative and willing to solve these problems for our patients, because they shouldn't have to worry about those things. All of my coworkers will tell you that I'm a good nurse, but all of my family will tell you that I'm not. And I think that's a big part of being an oncology nurse, is because you see people at the most raw points of their life, and you see people who are very, very sick. And so when somebody has a cold, they don't always get the empathy that they're gonna want from you, because it's, I've seen sick, you're not sick. It really gives you a lot of perspective on life, and the don't sweat the small stuff. Really being appreciative. I keep a gratitude journal. It's not difficult to fill the gratitude journal. For fun, I am a runner. I love to get out and get my shoes on and just go. And I trip many times a year, and it's because I run on trails, and when I run, it's like a form of meditation. I just stop thinking and I just do it, and then I come home with scrapes on my knees. And so that is one of the things that I do for my wellness. I used to say that I read as a sleep aid, and so being able to read is a wonderful outlet as well. I'm a skier. I like to Nordic ski. I get away as much as I can. With everything that happened in the world with COVID and isolation and all of those things, what we found and what I found with our patient population was all of a sudden we became our patients' best friends, and sometimes only friends, because when it comes to oncology patients, they listen to the guidelines, and if you said don't go out, they weren't going out. And so coming in here and seeing us was sometimes the only outing they would have in a week. I had a patient who came in one day and I said, "Your diamond necklace is beautiful." And she said, "My daughter told me to wear it." And she said, "What, I'm gonna wear this to chemo?" And she said, "Yes, you should wear it to chemo." So she dressed up for us because it was the only time that she was going out. And so we had a special relationship because we also, as nurses were doing what they asked us to because we didn't want to get our patients sick. And so we all kind of had this shared experience of really relying on each other for a lot of social aspects that you get from your friends. I have a patient right now who knew me before I owned a house, and then she watched me get married, and then she watched me have 2 children, and she still comes in because so much of cancer, it can be a terminal illness, but it can be a chronic illness too. We have a lot of special moments with our patients, but we also have years and years of friendship and sharing and stories, and it really creates a very special, unique opportunity.